Your doctor spends 8 minutes with you. But behind that visit, a process that can take weeks, involve dozens of codes, 3 or 4 organizations, and if one number is wrong, the whole thing gets rejected. That process is called medical billing. And by the end of this video, you will understand it completely, whether you want to work in it, study it, or just finally understand why your hospital bill looks the way it does. Let's start from zero. Hey, welcome, I'm really glad you're here. This is a complete beginner's mini course on medical billing. No prior knowledge needed, no medical degree required. If you've never heard a single term from this field before, perfect, this was made for you. Here's exactly what we're covering today. Module 1. What medical billing actually is and why it matters. Module 2. The step-by-step billing process, start to finish. Module 3. The 3 codes you absolutely must understand, CPT, ICD-10, and HCPCS. Module 4. What happens when a claim gets denied, and how billers fix it. Module 5. Medical billing as a career, the pay, the remote opportunities, and how to get started. Each module builds on the last. Stay until the end. Module 5 has information that most career resources don't talk about openly. And if at any point something clicks for you, drop a comment. I read every single one. Module 1. What is medical billing? Alright, Module 1. Let's build the foundation. At its simplest, medical billing is the process of translating healthcare services into insurance claims, so that healthcare providers actually get paid for the care they give. Think about it this way. When a doctor treats you, they've done their job. But no one hands them cash at the end of the appointment. Instead, someone in the background takes everything that happened during that visit, every diagnosis, every test, every procedure, and converts it into a formal financial request that gets sent to the insurance company. That formal request is called a claim. The person who creates, submits, tracks, and follows up on that claim. That's the medical biller. And here's why this job matters more than most people realize. Without medical billing, healthcare organizations simply cannot operate, they receive no payment from insurance companies, and the entire practice collapses financially. It is the financial engine of every hospital, clinic, private practice, and healthcare facility on Earth. It's invisible to most people, but without it, healthcare as we know it does not function. Now, medical billing is often mentioned in the same breath as medical coding. They are related but different. Medical coders take what the doctor documented and convert it into standardized codes, the universal language of healthcare finance. Medical billers take those codes and build the actual claim, submitting it, tracking it, and managing the payment process. In smaller practices, one person often does both. In larger organizations, they are separate roles. Quick question before we go further. Are you here because you want to work in medical billing, or because you want to understand your own hospital bill? Drop it in the comments. I want to know who's watching. Module 2. The billing process, step by step. Module 2. The actual process, from patient walking in to payment arriving. This is called the revenue cycle, and it has 8 main steps. Let me walk you through each one like you're seeing it in real life. Step 1. Patient registration. Before the doctor sees anyone, the front desk collects information: name, date of birth, contact details, and, critically, insurance information. This step sounds simple. It is not optional. If pre-authorization is required for a procedure, think MRIs, surgeries, specialist referrals, this is the moment to secure it. Delay here equals a lost claim later. Every claim that gets denied because of a missing pre-authorization started with this step being skipped or rushed. Step 2. Insurance eligibility verification. Before any service is delivered, the biller confirms that the patient's insurance is active and covers the planned service. This is like checking that the coupon is valid before you use it at checkout. If you skip this step and the insurance lapsed last month, you will not get paid. Step 3. Patient encounter and documentation. The patient sees the doctor. The provider records everything: the diagnosis, the procedures performed, and the clinical notes. This is the medical record, and it is the raw material for everything that comes next. If it is not documented, it cannot be billed. If it did not get written down, as far as insurance is concerned, it did not happen. That phrase, "if it's not documented, it didn't happen," is one of the most important principles in this entire field. Remember it. Step 4. Medical coding. A certified coding specialist translates diagnoses and procedures from the patient's medical record into universal health codes, CPT, ICD-10, and HCPCS, for billing. These codes tell the insurance company what was performed and why. We're going to go deep on these codes in Module 3, But for now, think of coding as translation. The coder takes clinical language and converts it into a financial language that insurance companies are designed to read. Step 5. Claim creation and scrubbing. The biller takes those codes and enters them, along with charges, provider information, and patient information, into a billing system or EHR, electronic health record. This creates the claim. Before submission, the claim goes through a process called scrubbing, an automated or manual review that checks for errors, missing codes, mismatched data, missing authorizations. A clean claim gets paid faster. A dirty claim gets denied. Step 6. Claim submission. The claim is sent, either electronically through a clearinghouse, a middleman system that checks format compliance before forwarding to the insurer, or directly to the payer. Electronic submission is now the standard. Paper claims still exist for specific situations, but the industry runs on digital transmission. Step 7. Payment posting. The insurance company processes the claim and sends back an explanation of benefits, EOB, a document that breaks down what they're paying, what they're denying, and what they're leaving to the patient's responsibility. The biller posts this payment into the system, applies any patient copay or deductible balance to the patient's account, and reconciles everything. Step 8. Denial management and follow-up. Some claims get denied. Many, actually. We'll cover denials fully in Module 4. The biller reviews the denial reason, corrects the issue, and resubmits, or appeals. This is the most underrated skill in the entire profession. We'll come back to it. Does this process feel more clear now than it did 5 minutes ago? If yes, hit the like button. It genuinely helps more people find this content. Let's keep going. Module 3. The 3 codes you must know. Module 3, and honestly, this might be the most important module in the entire course. Medical billing runs on 3 coding systems. Every claim you will ever work with uses at least 2 of them. Master these, and you understand the language of healthcare finance. Code Type 1, Captain codes, current procedural terminology. CPT codes are 5-digit numbers that identify medical services and procedures. Created and maintained by the American Medical Association, the AMA, these codes provide a standardized way to describe healthcare services. Think of Captain codes as the "what was done" code. A patient comes in for a routine office visit, that gets a Captain code. A blood test is ordered, Captain code. A surgical procedure is performed, Captain code. An X-ray is taken, Captain code. CPT codes tell the insurance payer what procedures the healthcare provider would like to be reimbursed for. Real example. CPT code 99213 equals an office visit for an established patient, moderate complexity, roughly 20 to 29 minutes. That one 5-digit number tells the insurance company, this was a standard outpatient visit, not an emergency, not a new patient, not a surgery. The insurer looks up that code, checks the contracted rate, and knows exactly how much to pay. There are Category I, II, and III Captain codes, covering everything from office visits and surgeries to performance tracking metrics and emerging technologies. Code Type 2, ICD-10 codes, International Classification of Diseases, 10th revision. If Captain is the "what was done" code, ICD-10 is the "why it was done" code. ICD-10 codes describe the patient's diagnosis, the medical reason the service was needed. They come in 2 flavors, ICD-10CM, clinical modification, used for diagnoses in all healthcare settings. ICD-10PCS, procedure coding system, used specifically for inpatient hospital procedures. ICD-10 codes are alphanumeric and incredibly specific. Not just broken arm, but which bone, which side, whether it's the initial visit, a follow-up, or a complication. Real example. ICD-10 code J06.9 equals acute upper respiratory infection, unspecified. Your common cold, officially coded. ICD codes and Captain codes work in tandem to create a full picture for the payer. This patient arrived with these symptoms, represented by the ICD code, and we performed these procedures, represented by the Captain code. Without both, the claim is incomplete. Insurance companies need to know what you did and why you did it before they pay. Code Type 3, HCPCS codes, Healthcare Common Procedure Coding System. While Captain codes cover most medical services, HCPCS codes provide additional codes for supplies, drugs, and services not included in Captain. HCPCS, pronounced HCPCS, has 2 levels. Level 1 is actually the Captain code system itself. Yes, it's nested inside HCPCS. Level 2 Covers things like ambulance services, durable medical equipment, prosthetics, orthotics, supplies, and certain drugs administered in a clinical setting. Real example. HCPCS code A4253 equals blood glucose test strips for home blood glucose monitor, per 50 strips. A diabetic patient gets test strips covered by Medicare? This is the code that gets it paid. The three together in one sentence. The patient came in with a urinary tract infection, ICD-10 code. We prescribed and administered an antibiotic injection, CPT code, and provided a 30-day supply of test strips, HCPCS code. 3 codes. Complete claim. Ready to bill. Which of these 3 surprised you the most? CPT, ICD-10, HCPCS? Tell me in the comments, and if you have a friend who works in healthcare and doesn't know these exist, share this with them. Module 4, Denial Management. What happens when claims get rejected? Module 4. And this one is where the real money is, in both senses. Here is a number that might shock you. Claim denial rates in the U.S. healthcare system average between 5 and 10%, but in some specialties and practice types, it can be significantly higher. Each denied claim represents revenue that the provider didn't receive, and that needs to be recovered. Denial management is the process of identifying why a claim was denied, correcting the issue, and resubmitting, or formally appealing the decision. Let's break down the most common denial reasons, because knowing the cause is 80% of the fix. Denial Type 1. Eligibility issues: the patient's insurance was inactive, the wrong insurance was billed, or the patient wasn't covered for that service on that date. This goes back to step 2 of the billing process, verification. The fix: re-verify insurance, correct the payer information, resubmit. Denial Type 2. Missing or invalid prior authorization: the service required pre-approval that wasn't obtained before the service was rendered. The fix: this one is harder. If the service was medically necessary and the authorization was simply not obtained in time, you can appeal with clinical documentation proving medical necessity. Prevention is better, which is why rigorous pre-auth workflows exist. Denial Type 3. Coding errors: wrong captain code, wrong ICD-10 code, mismatched diagnosis to procedure combination, upcoding or downcoding. The fix: review the documentation, identify the correct code, correct and resubmit. For complex cases, a coder and biller may need to collaborate. Denial Type 4. Duplicate claims: the same claim was submitted twice, or a claim looks like a duplicate even when it isn't. For example, the same patient receiving the same service twice on the same day for a legitimate reason. The fix: identify whether it's a true duplicate or a legitimate repeat service. For legitimate repeats, add a modifier code to signal to the payer that this is intentional. Denial Type 5. Timely filing exceeded: every payer has a deadline for claim submission, typically 90 days to 1 year from the date of service. Miss it, the claim is denied, and in most cases, it cannot be recovered. The fix: prevention only. This is why tracking submission timelines is a core biller function. The appeals process: when a denial is incorrect, when the payer got it wrong, the biller submits a formal appeal with supporting documentation, medical records, letters of medical necessity, provider notes, or corrected code assignments. Appeals can take weeks to resolve, but recovered denials directly add to practice revenue, which is why skilled denial managers are among the highest paid professionals in the revenue cycle. Denial management and accounts receivable roles command the highest salaries in remote medical billing, up to $75,000 and above. Here's a curiosity loop for you. If a denied claim that represents $800 of revenue can be recovered with a 30-minute appeal, what does that mean across hundreds of claims per month? The math is why this skill is valued so highly. Think about it. Module 5. Medical Billing as a Career. Module 5. And if you've made it this far, I want you to really listen here. Medical billing is one of the most overlooked career paths for people who want stable income, remote flexibility, and a clear growth trajectory, without a 4-year degree. Let me give you the real numbers. The salary picture. Entry-level medical billing positions start around $30,000 to $40,000 per year. Experienced professionals in high-demand states or specializations can reach $60,000 to $80,000 or more. Remote medical billing jobs specifically pay $38,000 to $75,000 plus, depending on specialization. The top earning roles are in denial management and accounts receivable. AAPC certified professionals earn an average of $62,689 per year to 16.6% more than their non-certified peers. Professionals holding 3 or more credentials average $76,035. Certification pays. Literally. The job growth. The BLS projects 9% growth in this field from 2023 to 2033, with approximately 16,700 new jobs per year. That is faster than average for all occupations. Healthcare is one of the few industries that expands regardless of economic cycles, and it always needs people to manage its financial back end. The remote reality. This is the part most people don't realize when they're starting out. A significant portion of medical billing work is now fully remote. The work is largely digital. Billing systems, EHR platforms, clearinghouses, and payer portals all operate online. Once you know the workflow and the software, you can do this job from anywhere with a reliable internet connection. Today's entry-level biller may become tomorrow's remote revenue cycle specialist, billing team lead, or even a business owner running their own billing consultancy. The career path. Here is what the progression typically looks like. Level 1, Medical Biller, Coder, Entry Level, Learning the Basics. Working claims, posting payments, supporting denials. Building speed and accuracy. Level 2, AR Specialist, Denial Management Specialist focused on recovering revenue. Tracking aging claims. Highest demand, higher pay. Level 3, Revenue Cycle Analyst, Team Lead Process Improvement, Payer Contract Analysis, Training Junior Billers. Level 4, RCM Manager, Director overseeing full billing operations. Strategic decisions. Salary of $70,000 to $100,000 plus. Level 5, Independent Billing Consultant, Business Owner starting your own medical billing company. Taking on physician practices as clients. Billing remotely for multiple providers simultaneously. How to get started. You don't need a medical degree. You don't need years of hospital experience. Here's the honest beginner path. Step 1. Learn medical terminology, the foundation of understanding what you're coding and billing. Step 2. Study the 3 code systems, CPT, ICD-10, HCPCS. Get familiar with common codes in one specialty. Family medicine is the most accessible for beginners. Step 3. Pursue a recognized certification, the CPC, Certified Professional Coder, from AAPC, and the CMRS, Certified Medical Reimbursement Specialist, from AMBA are the most employer-recognized entry credentials. Step 4. Get hands-on practice, through an externship, a billing company internship, or practice management software simulations like AAPC's Practicode. Step 5. Apply for entry-level remote roles. Build your track record. Specialize. The field is accessible. The path is clear. The demand is consistent. Let's lock in what we covered today. Module 1. What is medical billing? The process of converting healthcare services into insurance claims so providers get paid. Billers and coders work together in the revenue cycle. Module 2. The 8-step billing process. Registration, right pointing arrow, eligibility, right pointing arrow, documentation, right pointing arrow, coding, right pointing arrow, claim creation, right pointing arrow, submission, right pointing arrow, payment, posting, right pointing arrow, denial management. Module 3. The 3 codes. CPT equals what was done. ICD-10 equals why it was done. HCPCS equals supplies, equipment, and additional services. All 3 work together to tell the full story of a patient encounter. Module 4. Denial management. Denials happen. Common causes. Eligibility, authorization, coding errors, duplicates, timely filing. Fix the root cause, resubmit, or appeal. This skill is worth the most. Module 5. The career. $30,000, $80,000 plus salary. 9% job growth. Remote first. Clear progression. Entry through certification, not a degree. A message to the beginner. If this felt like a lot, that's completely normal. Medical billing is a field built on precision. It takes time to learn the codes, the workflow, the software, the payer quirks. Nobody becomes a skilled biller overnight. But here's what I want you to take away. Every single thing you learned in this video, every step, every code, every denial type, was once completely unknown to someone who is now a confident, employed, well-paid medical billing professional. They started exactly where you are right now. The difference between where you are and where they are is not talent. It's not connections. It's not a specific degree. It's time spent learning, consistently, one module at a time. You just finished Module 5 of a mini-course you didn't know existed an hour ago. That is already a beginning. If this mini-course helped you, like this video. It is the single most powerful signal that tells YouTube to show this to more beginners who need it. One click from you genuinely changes someone else's access to this information. Subscribe, Because this channel covers healthcare careers, medical billing, coding, and the business of healthcare, every week, in exactly this format. No fluff, no filler. Comment below. Tell me, which module was the most useful for you? And where are you starting from, complete beginner, healthcare professional, or someone who just received a confusing hospital bill? Share this video with one person who would benefit. A friend who's looking for a remote career. A family member trying to understand their medical bills. A student considering healthcare administration. This information changes career trajectories, and it should reach as many people as possible. Thank you for watching the whole thing. That matters more than you know. See you in the next one.